Hello, my name is Tony Cobrooker. I wanted to start by saying how deeply humiliated and ashamed I feel to have to be making this video, especially at a time when I know everyone is struggling so much financially. Um, for those that don't know me, I suspect most of you will. I have a really rare health condition called myelin oligodendrocyte glycoprotein antibody disease. It stands for MOG for short. And it is a little bit like MS, although it has a slightly better prognosis in that it normally presents as optic neuritis, which is how I had it. However, back in 2017, I was misdiagnosed with MS and then only found out 6 months later that I had MOG. And I was not treated at the time because you don't treat MS patients with steroids anymore in their first acute phase. Whereas if we'd known it was MOG, then I would have received steroid treatment and I would have regained the damage that's been caused to my left eye. I have color and nerve pain, basically color damage and nerve pain in my left eye. I also have cysts in my brain in both sides of the thalamus, which is too deep to biopsy or remove. So basically, I've just been monitored every 6 months with MRIs. It's actually gone to a year now because of the strain on the NHS. But basically, since 2020, I've been complaining to the NHS for leg weakness in my left leg. I've suffered 3 herniated discs, the same disc, on 3 separate occasions over the years. I've been to and from A&E, to and from my GP, to and from my neurologist, complaining about back issues, really, really bad back issues. So, like bilateral nerve pain, saddle region, I don't know what you call it, not paralysis, but numbness and tingling in the saddle region. While trying to pursue that through our NHS, I've also paid privately out of the pocket, probably to the sum of about £500 a month, which is a lot of money, to have physio, rehab physio, massage therapy. I've had CBT on the NHS. I've paid for my own therapy privately to deal with all of this medical difficulty. And the reason why I'm making this video today is because I've exhausted all possibilities of being able to pay for this treatment on my own now. And the issue with my back has got so bad that I've started to lose control of my bladder and my bowels. Since the start of this year, 2024, I've been complaining about urinary issues. I've had urinary retention and issues with my bowels since January, and I've been complaining, going into A&E, asking for help, asking for scans. I get turned away every single time. I get palmed off onto another department. Every time I go to the GP, they give me laxatives, or they say that I've got a UTI, even though there's no infection present in my urine tests. And it's taken 7 months to see a urologist because I've had the appointment cancelled so many times. I can only imagine it's because of how many people are trying to access the service. But what's happened in that 7 months is the deterioration of my bladder and my bowels. And at that urology appointment, I found out that the back injury has been compressing the nerves to my bowels and my bladder and also to my left leg. I now have permanent weakness in my left leg, and the signal that my brain sends to tell my bladder and bowel to work is breaking down. So I've now just been told that I need to start using a catheter. They haven't even spoken to me about the bowel situation yet. But obviously that is so upsetting. Although I know it's many people's everyday life, it's so upsetting to me that their inaction, their inability to listen to me while I've been desperately advocating for myself. I'm not someone that just goes, okay, no problem, I'll go home and I'll manage with the pain. I really, really have put up a big fuss. And if they were to look at my call record, calling 111, calling the GP, calling the neurologist, going into A&E, sitting for hours and on. Sometimes I've sat for 12 hours in A&E just to be sent home without even doing a urine test. It should be absolutely best practice to do a scan if someone has had a back injury like a disc herniation or prolapse, and they've got urinary issues, because it could be cauda syndrome. Um, I've not had good care from the NHS at all. And although they are going to be teaching me how to put in my own catheter in the next few days, there's no treatment plan in place for my back, my bowels, or my leg. And I'm worried that if I don't do something about it, my deterioration will get worse and worse. Um, so I've had to privately look into what surgery will cost for a discostomy. I can't remember how you pronounce it, but it's basically they remove part of the disc that is putting pressure on the nerves, and it's about £10,000, and that doesn't even really cover like the rehabilitation. This is just so outside of my financial means, my emotional ability. Like I don't know what to do. I'm not a lazy person. I work really, really hard. And this has been ruining my life. It's preventing me from being able to work and hold down a job. It's I've had to cancel holidays, I've had to cancel work. It's having an effect on my marriage. It's affecting my friendships because I'm having to cancel on people all the time. But more than anything, it's wrecking my emotional health. So I can't do anything. I'm powerless right now unless I ask my friends and my family and my community for help. I'm so sorry that I have to do this. I've been told over the years by many, many friends to start a fundraiser, and I've always said no. I've always wanted to try and manage it myself. I've had a lot of help from my husband over the years, but it's just all getting too much for us, too financially too much, emotionally too much, and I need help. So yes, I'd like to try and fundraise for the surgery so that it can happen sooner rather than later, and I can hopefully regain back the use of my body, my normal bodily functions. And really, I'd like help trying to raise funds for rehabilitation as well. So I don't really know what to set this at. I might have to set it at about 15,000. Oh, this is deeply embarrassing for me. But thank you for watching this video, and thank you for your help.